Cameroonians begin responding positively to the COVID-19 Special Solidarity Fund created by the President of the Republic yesterday to back ongoing efforts to prevent, detect, and respond to the killer coronavirus. Markets in Cameroon are yet to fully integrate the anti-COVID-19 fight as the high presence in them undermine the social distancing and flouting preventive and hygiene prescriptions. As the coronavirus pandemic dragged formal learning into a standstill in Cameroon, students and teachers go digital with online but off-campus teaching becoming the new modus operandi. Those are our lead stories. Thanks for joining us on the CRTV. I am Ben Menopufong and this is the 7:30 News. Barely hours following its institution, there has been a generalized positive response to the creation of a special national solidarity fund by the head of state as part of Cameroon's strategic plan against the coronavirus pandemic, with many viewing it as a vital step in leading the ongoing fight against the coronavirus to a less devastating denouement. Kilian Ndifon talked with Cameroonians from different walks of life on the import of the initiative, who, in the following report, salute the gesture as strategic, humanitarian, and life-saving.
By creating a special solidarity fund, President Paul Biya makes a decision which speaks to the humanitarian subconsciousness of Cameroonians.
This gesture is a humanitarian action. It's an action that is intended to put together all Cameroonians, to put their resources together to face a common threat that is affecting our nation. And we know the President has made it a culture in the past when Cameroon is faced with a problem. He has always invited Cameroonians to put their heads together, and this has been done.
Beyond the traditional humanitarian gesture, it is also an official strategy to face adversity.
It is in line with the strategic culture of Cameroon, which seeks to federate all citizens to a common front against an enemy, which in this case is the COVID-19. The president here makes a decision which protects the Cameroonian citizens.
The decision falls in line with the functioning of a typical Cameroonian traditional setup.
Traditionally, chiefs in the days of our fathers and forefathers reacted in the same way faced with the plague that threatened the community. The chief sat down with his notables and drew up a strategy to liberate his society from such a plague. We only have to come together and give our contributions so that the special fund should be functional.
Unity is strength, and the Special National Solidarity Fund against coronavirus is a pillar of the unity that calls on board every Cameroonian.
And it is the entire nation that is being called upon to mobilize to beef up the Solidarity Fund, whose dividends should help the nation face up to the challenges of the anti-COVID battle, both in the area of prevention and follow-up. Joyce Kimbi-Fawaju now makes a case for a truly national solidarity, even if it entails chipping in just a widow's mite.
At such a time like this, no one is expected to remain indifferent. Cameroonians, whether big or small, are urged to chip in contributions into the fund to bail the country out of the coronavirus quagmire. In fact, for the fund to function, financial and material necessities are inevitable to contain and stop the spread of this killer virus in our country. Government has handled it this far and is still doing it, but government cannot handle it alone. The financial and material burden is huge and was never budgeted. All hands are expected on deck. Individuals, bayam-selams, traders, business tycoons, sportsmen and women, bankers, civil servants, in fact, all and sundry from the different sectors of our society are expected to financially and materially support the health crisis caused by the coronavirus spread. It's continuing to wreak havoc across the globe, leaving thousands dead. And unfortunately, infected cases are increasing daily in Cameroon, instilling fears of a possible disaster ahead if the pandemic is not contained. The virus has proven to know no class, color, rich or poor, so it is a concern of all, given each of us is exposed to be killed by this virus if care is not taken. Reason enough to call for a show of solidarity in kind and cash to bar the way for the deadly coronavirus pandemic from consuming the population. The giving and solidarity spirit of Cameroonians had earlier been tested, and it paid out. When the northern regions of the country were infiltrated by the Boko Haram sect, Cameroonians joined hands together to raise financial and material assistance to help government fight the insurgents. Same scenario was witnessed when the humanitarian situation in the crisis in the northwest and southwest regions took an ugly dimension. So, once more, our grace of solidarity and giving needs to be proven further to assist in booting out completely this global life-threatening coronavirus pandemic.
And in a rather swift and prompt reaction, Cameroonian businessman Baba Danpulo has opened the Special National Solidarity Fund with the sum of 100 million CFA francs. He handed over the money in Yaoundé to the Minister of Public Health today, Manauda Malachi. Maimouna Njoya reports on that gesture from CRTV Center.
Sharp increase in the number of coronavirus cases in Cameroon is a cause for concern and has today prompted timely reactions from every sphere. Following the head of state's call for Cameroonians to contribute in the fight against COVID-19 through the Special National Solidarity Fund, the prolific Baba Danpulo Group has been quick to give a helping hand to the tune of 100 million CFA francs.
We came here together with all the representatives of our company to bring our support to the Cameroonian government, especially to the Minister of Health, in order to see how we are going to do in order to fight against the coronavirus in Cameroon. Considering that the calls of the head of state, Mr. Paul Biya, that is why we are together here in order to give our support.
The goodwill gesture was preceded by a discussion with the Minister of Public Health, Manauda Malachi, during which representatives of the Baba Danpulo Group pointed out that their head, who is Amadou Baba Danpulo, famous economic operator and owner of the third mobile telephone company in Cameroon, Nextel, has always been sensitive with regards to crisis situations. They, however, cited as a reminder the 2019 special donation to victims of the sociopolitical crisis in the northwest and southwest regions. In response, Minister Manauda Malachi applauded the gesture while recalling that the fight against the coronavirus must be taken seriously and Cameroonians must be keen when it comes to respecting the protective guidelines against the pandemic.
Let's now talk about fighting the coronavirus on the ground, especially here in the nation's capital, where the teeming population in markets in Yaoundé does not at all go well with the ongoing struggle to slow down the spread of the COVID-19 virus. The degree of promiscuity in markets is such that puts everyone at danger, as neither the social distancing nor the hygiene measures are being given any serious heed. Constantine Baum reports that with the looming danger of escalation, council authorities have got to sit up to avert the worst from befalling Cameroon.
This situation depicts what goes on in markets in Yaoundé. There are few hand-washing points, and most of the traders are aware of the havoc caused by COVID-19. Some of them personally have their detergents for hand-washing. This shows that the sensitization messages are being understood. The challenge in the markets now is that of respecting the social distancing principle, as the markets are not only more than 50 persons, but are even crowded. If any infected COVID-19 person gets into the market, lives will be at risk. Therefore, councils need to wake up as they control the markets.
It's important for us to have materials for the disinfection of the market. Have a meeting, the 7th mayor of the town, and it was important for us to take some measures to ensure the safety of our population, and we hope that in few days we'll have all the support.
The crowded market situation is also very disturbing to the mayor of Yaoundé 5, whose team has already started with sensitization campaigns to enable the busy traders understand the challenging situation in which they find themselves.
We intend to see from next week how to regularize the open hours of those markets so that they will not continue to be open 7 days on 7, but we can open our market, for instance, only for some days in a week.
It is a similar reaction gotten from the mayor of Yaoundé 7. All the mayors in Fundi have informed their supervisory authorities of the challenges they encountered, with them making proposals for authorities to provide the appropriate equipment needed to regularly disinfect markets. The powers of the municipal authorities go beyond markets, as a couple of business centers are being temporarily closed down for not respecting some of the 13 measures that help in curbing the spread of COVID-19.
And it is in that direction that some 82 street children in Yaoundé are presently undergoing a 3-month reinsertion program in social affairs centers in order to reintegrate them in mainstream social life and keep them out of harm's way. The action that is being spearheaded by the Ministry of Social Affairs and other partners is part of the ongoing national effort to check the spread of the COVID-19 in Cameroon. Details with Romeo Kenya.
This is Colombia, a hideout place for street children in Yaoundé. In this ghetto, many have lived for more than 5 years after abandoning their different homes. Today, the Ministry of Social Affairs has decided to reintegrate the kids into normal life.
The activity we started today is to make the street children less visible in the commercial center, to offer them minimum care and daily follow-up. We want to make sure that they don't go back to the street. Our aim is really to make these children either to go back to their families or maybe to go back to school. Some of them may go back to school, or maybe to teach them some jobs.
Expected to reside in some 4 social centers for a period of 3 months, the youngsters will be trained in different domains. For this to be achieved, their health remains a top priority, given the present context.
That's why, if you have noticed, when we took them, we had to take their temperature. And we will do that morning and evening. And we're planning to do the test for those 82 children, so that those who will be positive, we'll put them aside, to continue protecting them, to continue giving them enough care, medical care.
Assisting Minas in this move is the General Delegation for National Security, whose agents are using the National Video Surveillance Center to locate children still languishing on the streets.
Students of the 8 faculties of the University of Yaoundé 1 have remained up to date in their studies with online lectures instituted by the university hierarchy, even as the coronavirus outbreak induced government to shut down schools. The last 2 weeks following the suspension of lectures in amphitheaters has recorded close to 2,400 online courses delivered online through the website of the institution. The rector of the university, Professor Maurice Aurelien Soso, says plans are underway to broaden the virtual lecture platform. Emmanuela Vermue reports on how the lectures are running.
It is real. The University of Yaoundé 1 now runs online lectures for students of the 8 faculties up to the master's level. With just a click, the student accesses the portal of the institution and from there can choose his or her faculty, department, level, right down to all of the courses he or she offers. A platform the rector of this institution, Professor Maurice Aurelien Soso, says went into effect since March 16 with the temporary shutdown of the institution. 2 weeks on, close to 2,400 online lectures have been delivered to students of the University of Yaoundé 1 with a possibility to read them online or download for future use. With each download rated at almost 50 francs, the rector says plans are underway to reduce it to almost 0 francs CFA. But how exactly does this platform function? Computer engineers of the University Center for Technology and Information, QT, receive prepared material from the different lecturers by emails daily. then lodge it into the website for access by the students.
Here I receive my lectures online. It is so normal since lectures in amphitheaters were suspended. Many faculties are receiving online lectures.
Plans are underway to step up online lectures in the University of Yaoundé 1 to including virtual lecture halls. Students and their lecturers can meet online for studies.
Secondary schools in the nation's capital, Yaoundé, are not left out of the technological fray as they too are gradually adopting the online classes method to continue educating students at home as the coronavirus challenge persists. The online courses coordinated from the school's multimedia centers have been saluted by most parents who can't wait to see the end of this debilitating pandemic. Ewane Epole was on one of the campuses for an eyewitness appraisal.
This is Collège Vogt, one of the lay private secondary schools in Yaoundé that has put in place measures to continue educating their students online through audio and video lectures during this period of coronavirus challenge.
We made sure, first of all, that each parent was connected and could get access to those lessons. After that, we sent to them the user and passwords of their children so that they could use the platform. After that, we downloaded the lessons on the platform for them to read and copy in their ancestors' books and to do the exercises.
Most parents have lauded the ICT method of education introduced by the Catholic Learning Institution.
It is very, very good initiative.
I follow the normal school program but at home. The lessons that have been taught for that day, I will go into the forum, the platform, and then take the lessons that the teachers have presented. Together we look at it and we work. Then send all the work through the platform to the teachers.
The online courses coordinated from the multimedia center of the school are expected to last throughout the crisis period in respect of government's decision to limit the spread of the deadly COVID-19 pandemic.
The director of the Bafoussam Regional Hospital has refuted allegations that a female COVID-19 patient had escaped from her quarantine ward in the health institution. Dr. George Enorok told CRTV Western Bafoussam that all 6 registered cases are in the regional hospital and responding positively to treatment. Gu Henry has been following the story and now reports from Bafoussam.
This is the Bafoussam Regional Hospital, which has this far registered some 6 cases of the COVID-19.
5 cases have been quarantined in our isolation ward, and the 6th patient is under quarantine in the house.
He has debunked rumors that a female patient of the coronavirus ran away from the hospital.
I think we should just avoid this fake news. None of our patients has evaded hospitalization.
The hospital has taken measures to handle cases of the COVID-19.
Divide our patients into various categories: symptomatic, asymptomatic, symptomatic negative, symptomatic positive, suspected cases. We hospitalize only positive symptomatic cases. The rest, we collect them right from the entrance of the hospital. We isolate them, examine them, and if you are suspected, we advise you to intensify domestic isolation.
The director of the Bafoussam Regional Hospital has called on the population of the West to respect hygienic norms so as to curb the spread of the COVID-19.
The traditional April 1 Epaulet Award ceremony was low-keyed today in Bamenda because even the defense forces have adapted to the new behavior patterns recommended by government and WHO to curb the spread of the coronavirus. The top brass of the military in the region say apart from facing the separatists, they have also gone on to war against COVID-19. Details with Winston Lebga in Bamenda.
Without pomp and circumstance, these three soldiers received their new epaulets here at the 6th Military Sector. The man is a senior warrant officer. The women are corporals. No handshakes. That is the rule. The coronavirus scare obliges. Keeping the hands clean is a must. And here, at the headquarters of the 5th Joint Military Region, Brigadier General Cavaler goes through the ritual. And even here, at the 5th Gendarmerie Region's command post.
Everybody who enters here must wash his hands. Everybody. Yes, even if you are not going to greet anybody, but you wash your hands.
Come in, please.
Here.
Go ahead.
I see that there were people, some people entered here without washing their hands. You have people inside there. Did they wash their hands? Are you sure?
The military commanders in Bamenda said they are now fighting on two fronts, against the secessionists and against COVID-19.
The Southwest Regional Delegation for Public Health has received appropriate protection material and equipment for its medical staff who are on the front line of the fight against the spread of the coronavirus. The material and equipment from the Ministry of Public Health were handed over today in Boya in the Southwest Region to the Southwest Region Delegate of the Ministry in a meeting chaired by Governor Bernard Okalia-Bilai. Details with Regina Ngale Ndoko in Boya.
Medical personnel in the Southwest region will now have at their disposal materials that will enable them safely handle COVID-19 suspected cases without being infected, thanks to the equipment sent by the Ministry of Public Health.
Because they are the most exposed in the course of their work, and also some specimen collection kits that will pick up specimens from suspected cases and send to Yaoundé.
While chairing a meeting to evaluate the level of implementation of the measures taken by the government in the fight against COVID-19, Southwest Governor Bernard Okalia-Bilai called on authorities to ensure that children who have been turned to traders are taken off the market. Meanwhile, measures to scale up the fight against COVID-19 have been intensified with the creation of isolation units in all 12 district hospitals.
So that if cases are picked up in the districts, they can be isolated for our teams to go down and pick up specimens and also quarantine them to limit the spread.
Southwest Governor Bernard Okalia-Bilai has called on the population to maintain strict hygienic conditions and social distancing in a bid to combat COVID-19.
A local non-governmental organization known as the Local Youth Corner Cameroon, in collaboration with other youth associations, has begun an initiative dubbed Operation One Person, One Hand Sanitizer, while presenting the 4,000 bottles of hydroalcoholic solutions to the Minister of Youth Affairs and Civic Education today. The coordinator said this campaign was inspired by the current shortage and increase in the prices of hand sanitizers in shops and pharmacies in the country. Let's now listen to the national coordinator of the Local Youth Corner Cameroon, Achaleke Christian Leke, as he explains the raison d'etre of the initiative. He spoke to our reporter, Gerard Nanji.
We could mobilize youths from different walks of life, including medicine, including pharmacists, including nurses, and other young people to start a campaign of Operation One Person, One Hand Sanitizer, where we would follow the rules of WHO and work with these scientists to produce these homemade hand sanitizers to give to people for free. Because at this moment, we cannot make money out of people suffering or enrich ourselves when people are going through so much pain. Our idea is working with these young people to ensure that we go from door to door, we go from places to places and give people access to these things because they are very expensive. I wonder how an old mother would do to get a hand sanitizer. But if we come to her doorstep, I'm sure the joy that she's going to feel, words cannot explain.
On a steady climb in Cameroon, 13 new positive cases takes the total number of COVID-19 patients in the country to 246. This is the latest information from the Cameroon Health Emergency Operations Center in Yaoundé. We'll now try to hook up with our reporter Beatrice Ngum, who should be telling us details on how we came about this sudden rise again in figures. Hello, Beatrice.
Good evening, Ben. I'm right here at the emergency operation center downtown Yaoundé, where the press briefing announcing the new cases is ongoing. As we speak, there are 246 new cases in Cameroon, and government too has come up with strategies to help respond to the COVID crisis in the country. For now, 15 more days to help obey the 15 days that have they are talking of 15 more days for Cameroonians to respect the rules that government has prescribed. With me is Mr. Dr. Tande Eric. He is a public health expert. He will be telling us more on these updates and also on the different regions where the different cases are now. Good evening, Doctor.
Yeah, good evening, Beatrice.
We want to find out from you, where are the regions where we can get the cases as we speak, the different cases in Cameroon?
Thank you very much, Beatrice. Just to update that we've not had any change in the situation as far as cartography is concerned, based on what the Minister of Public Health, Dr. Manaouda Malachi, has earlier announced. We have the central region, littoral, the west, and of course the southwest region where Limbe records a case.
Now, you've told us about these regions. We are aware that there is a flight that came into the country yesterday, 3 flights carrying Cameroonians from the diaspora. Can you tell us, where are these Cameroonians now and how is their situation like?
Yeah, thank you for your question. You know, just a few days ago, the Minister of Public Health, in collaboration with the Minister of Territorial Administration and all regional governors, came together in the process of decentralization, not only in the governance, but in the management of COVID-19, agreed on providing social housing. So all those who have arrived on the air flights have been taken care of in some of these social houses with conditions favorable to keep them to observe the incubation period in order to give them a test of being positive or negative to keep the virus out of our community.
Now, we are aware that 14 days for those who were in quarantine ended yesterday. Can you update us on their situation? Were they discharged? Are some of them still in some of those hotels? Can you update us on that?
That's right. I should tell you that we recorded quite a very good results as far as this is concerned. Yeah, the 14 days, 2 weeks that they were supposed to observe were respected. And to assure you, those who their results were negative were actually discharged and sent home, but reminding them to continue to respect the government measures as well as the Ministry of Public and WHO recommendation on the safety and the safety of the population around them. However, the cases that were positive were transferred to health facilities with competent personnel and services that could give them proper care and treatment to the end of the disease.
Now we are talking of 246 cases in Cameroon. Cameroonians are a little bit panicky as the figures are increasing by the day. What can you tell them to reassure them psychologically, because a lot of them are psychologically down?
To give a summary of it, there should be no panic as far as COVID-19 is concerned. First, remember there is a toll-free number. And again, secondly, there is free diagnosis and treatment once you have been proven positive. But I want to equally remind the population of Cameroon that the majority of the cases that have been diagnosed positive are mostly cases that came from abroad. And the family relations around them that have been proven positive. So there is no need for Cameroonians to panic. I should insist here that Cameroonians should continue to contact the toll-free numbers and other numbers that have been provided by the Ministry of Public Health to come for their care or rescue in case they have the symptoms that have been prescribed.
Thank you very much, Doctor.
Yeah. Thank you.
Ben, you have heard the curve is on an increase, but medics are reassuring that if Cameroonians adopt the new behavioral pattern prescribed by government, there is hope that the curve could flatten. Live from the Emergency Operations Center, downtown Yaoundé, I'm Beatrice Group. Back to you.
Thank you very much, Beatrice, for those updates. And unless and until Cameroonians take a responsible attitude to go out to that number 1510, those figures will keep increasing. Thank you once again, and we continue on with this newscast to say the number of deaths from the coronavirus in the United States has surpassed the official tally in China, with more than 3,400 fatalities recorded. The U.S. now has the third highest death toll after Spain. And meantime, on the African continent, South Africa is topping the chart with 50 deaths. Gilbert Ongene has a roundup of the situation of the coronavirus across the globe in this report.
Further restrictions on movement are being considered in the U.S. to curb the spread of the virus, with the country now reporting twice the number of cases as China, where the outbreak began late last year. Meanwhile, Spain, the United Kingdom, and France each reported their biggest overnight jump in deaths since the start of the pandemic. Around the world, more than 820,000 people have been confirmed to have the virus, and at least 174,000 have recovered. More than 40,000 people have died from the COVID-19 across the world. On the African continent, 5,856 cases of infection with 201 deaths and 430 recoveries this far, with a number of African countries imposing a range of prevention and containment measures against the spread of the pandemic. According to the latest data by the Africa Center for Disease Control on COVID-19, the breakdown remains fluid as countries confirm cases as and when. The whole of Africa has rising cases, with a handful of countries holding out.
You're watching the 7:30 news on the Cameroon Radio Television, the CRTV. We are beaming live from Yaoundé. The Committee on the Production and Trade of the National Assembly has scrutinized the bill governing postal activity in Cameroon, which seeks to increase the quality and accessibility of postal service nationwide. The bill was defended by the Minister of Posts and Telecommunications, Minette Libom Lilinkeng, who told reporters that the reforms will significantly contribute towards the attainment of the 2035 emergence ideal in the post and telecommunications sector. Esther Kima has the details.
Cameroon's postal service today plagued by the proliferation of operators carrying out postal value-added activities that are not governed by the regulations in force, leading to inefficiency and poor quality service, was the main preoccupation of the members of the Committee on Production and Trade. To address this deficiency and to redeploy its development strategy, the bill to govern the postal sector is a government response.
Many actors were working in the informal way. This law will put in place a regulator. This law is very important for the modernization of the postal service. You cannot make e-commerce without post services. You cannot really communicate with the rural area.
The Integrated Postal Reform and Development Plan guarantees not only the quality and affordability of postal services, but also an increase in the network density.
Now our post is going to engage its digital transformation. You need to organize the financial activity. You see, until now, you see microfinance, everybody making transfers of funds and so on.
The bill institutes, amongst others, a postal fee of about 5% based on pre-tax turnover of postal operators and a 1% tax imposed on the post office money transfer nationwide.
And now on to this release from the Constitutional Council, and it reads, the President of the Constitutional Council is informing the public and interested parties that for electoral disputes of the rerun of the election of members of the National Assembly of the 22nd of March 2020 shall hold on Thursday the 2nd of April 2020 at 11 a.m. in the courtroom of the Constitutional Council at the Yaoundé Conference Center, and that session will be holding in strict conformity with the ongoing measures geared towards curbing the spread of the coronavirus. And it has been signed by the President of the Constitutional Council, Clement Atangana. Over the past 10 years, the state of Cameroon has invested well over 270 billion CFA francs in the transport and urban development sectors in the country, and this chiefly with funds raised from the financial markets through the treasury bonds. In the third of our series on public securities and their achievements in Cameroon in the last 10 years, Clarice Array-Takang runs us through the major signposts in the transport and urban design sectors.
The Kribi Deep Sea Port has been commercially opened since the 2nd of March 2018. 94 billion CFA francs was the contribution of the state for the execution of the first phase. Funds were secured from almost all public securities operations launched since 2010 to see the project through.
The high of port is very good, nice now, because in 2012, when the road was not already nice, I missed even an accident, but now the road is good. Yeah, it has brought business a bit.
It has brought jobs. In Kribi, youth are excelling. There is light and there are more tourists.
While efforts were made to develop maritime transport, urban design was also given a push in the past decade. Access roads have been maintained, major streets rehabilitated, the entrance to major towns constructed, and motorways are in the works. Jobs followed. A number of infrastructural projects were instrumental in giving a first lift to the capital city, but equally to a number of neighborhoods. Structures related to the Olembe low-cost housing scheme, the Mfundi Canal, and the Douala rainwater drainage project sprang up. Growing the transport sector in Cameroon and urban development remain on the agenda of the state. The contribution of funds raised from financial markets is expected to enable the government achieve this goal.
That's where we leave it for the 7:30 news this Wednesday evening. Let's do it all over again tomorrow. Thanks for watching.
CRTV News, ici, toute l'info.